50,000 mothers and more than 1 million babies. Some are stillborn, and some die within the first month of their life, year after year. It is not a fate they deserve. A large number of these deaths are due to complications that set in during early pregnancy and soon after the delivery, the time when their health is most vulnerable. Each of these women needs and must have access to basic health care that can keep her and her child safe and healthy throughout the motherhood. Maternal mortality is not a disease. It is preventable. And yet, women are dying. Their ability to survive something like childbirth is deeply linked to poverty, malnutrition, and the absence of basic health care.
This is my grandchild. We lost her mother to severe bleeding after a few weeks of her delivery. We didn't know what was happening to her, and there was none to help us.
For mothers living on the fringes of poverty and deprivation, midwives can indeed become the key to good health and survival. Regular monitoring, timely treatment, and early diagnosis of high-risk pregnancies can indeed be a big lifesaver for them. The challenge of saving lives may seem formidable and the solutions complex. However, in places where maternal health and survival have been improving, the most effective programs have been the simplest and perhaps the least obvious.
Midwife-based models of maternal care have shown across the world to be effective, safe, and comfortable and low cost. Even in India, where we tried out midwife model of care in different states, we found that the comfort level of the mothers is increasing as midwives gain confidence. And during childbirth, midwives have shown that their care leads to less complications, less interventions, and happier mothers and babies.
Women take care of their health most when their health can affect future generations. But imagine being pregnant and alone, turned away from receiving care because you don't have the money, or having your healthy newborn die in your arms because there was no one to teach you simple life-saving techniques. Institutional health provision in India has not been very successful in reaching out to these mothers with the sensitivity and care they deserve.
85% of pregnancies are usually uncomplicated and are otherwise known as low-risk pregnancies. Professional midwives are trained to take care of normality, and therefore, if we have midwives in the community, they could take care of women during their pregnancies, labor, and delivery.
It is time now to promote a woman-centered, more natural and less invasive care. A midwifery model of care, covering the entire continuum, from the community up to the specialized hospital. Midwives can indeed change the face of maternal and newborn care in India.